Okay, I think we'll start. I'm sure people will keep kind of trickling in, but I'll go ahead and begin. Just wanted to welcome everybody here today to our World Eczema Day. Our theme today is If You Only Knew. And this is the fourth year in a row we've raised awareness for World Eczema Day because around 95% of the TSW community comes from those who are diagnosed with eczema first, and they developed TSW syndrome after using topical steroids to treat their eczema. So the more that we can raise awareness within the eczema community, the more we can help prevent TSW syndrome. If TSW patients and caregivers had received better treatment and better advice and options from diagnosis on, it really would have been a game changer. So the more we can raise awareness within the eczema community, the more we can help prevent TSW. And topical steroid withdrawal syndrome is very debilitating in numerous ways. So not only does the body suffer tremendously, but the mind and emotions do as well. And this condition can be especially difficult, as we all know, if you're not supported by your physicians or your family and friends, your core inner circle. And so today we will discuss the mental health impacts of developing TSW from using a trusted medication and trusted advice to treat our eczema. So thank you all for joining us as we speak with licensed mental health counselor Jen Garcia about how to best manage this difficult experience. So a little bit about our speaker tonight. As stated, we are so pleased to hear from Jen Garcia. She is a licensed mental health counselor in the state of Massachusetts. Her practice is in the city of Salem, just north of Boston. And she says, yes, that's Salem with the witches. And her specialty is trauma. She started her higher education in 2000, graduating with a bachelor's degree with a dual major, psychology and creative writing, in 2004. In 2005, she moved to Boston to pursue her master's degree in counseling psychology. And it was her internship at a rape crisis and domestic violence center where she found her passion and her mission, and that was trauma. In 2007, she graduated with a Master's of Science in Counseling Psychology from Northeastern University. She started with gender-based trauma and sexual assault, and her work over the next 16 years grew to include community violence, the trauma of poverty and racism, and family and generational trauma. Now, through the lived experience of her 4-year-old, it includes medical trauma. She's worked in community-based mental health centers and after-school programs in partnership with Boston Public Schools as a clinical supervisor for graduate students at Boston College and postmaster's clinicians working in the field. So in 2019, after the birth of her second baby, she opened a private practice. And that same year, her 4-month-old developed eczema. And in her private practice, she still specializes in trauma, though she works more with adults than adolescents and children. And she's passionate about supporting and educating people through their healing journeys, both emotionally and physically. So her lived experience of both of those informs her practice and helps her be better equipped to connect with others. I'm going to figure out how to add these links in the comments because you can find her by searching her name in psychologytoday.com. And then she has Indigo Counseling and Psychotherapy.com. She has TikTok, Etsy, Instagram. I will place those in the comments. But I am just like so pleased that you can come speak with us today, Jen. And I'm going to turn the time over to you. And if you don't mind, just tell us your background and what brought you to the TSW community and a little bit about you and your daughter's story.
Sure. Thank you. Welcome, everyone. I'm looking forward to kind of like sharing my story and also giving some hopefully really validating information for you all. I am a mom of 3, and my middle child is 4 years old. Her name is Lucy. When Lucy was 4 months old, she developed eczema. Now, eczema runs in my husband's family. Eczema, food allergies, kind of like all of that atopic type stuff. And so I was aware that this was a condition that we would probably face, as my nephews and nieces had the same thing. So originally we kind of stayed away from topical treatments until it really kind of started to explode all over her body when she was an infant. At that point, we saw a dermatologist, and they recommended the wet wrapping, right, where you slather them in the steroid cream, put them in the wet pajamas, and then wrap them in the.
I'm sorry, Jen. I don't know if it's just me, but you're freezing a little bit.
Okay.
We
What did
heard
you
you
miss?
up to wet wrapping.
Okay. So the dermatologist recommended wet wrapping, which we followed. They said we could do that for, I think they said up to a week. Honestly, we probably did it for 2 or 3 nights until the eczema, disappeared pretty quickly. And then from then on out until she was about 3.5, we would occasionally use her prescriptions. Now, over those next 3 years, the prescriptions stopped working, right? Which is what all of you guys already know. And at about 3.5, we were probably on our 3rd or 4th topical steroid. We were being told that these were, safe, that they were very low dose topical steroids. We were recommended not to use them more than 2 weeks at a time, which we did not. Really more like spot treatment, probably once a month, maybe once every 3 months. And so at 3.5, I decided this is too much. I don't want to go further down this road. Let's reroute. Because in the back of my mind, there was kind of this like warning about topical steroids. I couldn't have verbalized that then. I couldn't have told you what I thought that I knew. It was just kind of a gut instinct. And any of you who are on here as a parent, you know exactly what I'm talking about. You just kind of get these feelings and you just know. So my husband and I decided to seek alternative treatment, alternative medicine for Lucy. So we turned to a naturopath, we turned to a homeopath, and we started going down that route because there is a lot of kind of natural based stuff that you can do to support the immune system. I had no idea. There was no way, obviously, that I could have known what we were getting into. But it was June of last summer when we probably did the last dose of a topical steroid. And by the end of August, her skin, she was unable to be outside. I live in New England, so the summers aren't that hot, not compared to other places in the United States, but she just couldn't tolerate anything above 70 degrees. She was indoors. She really, like, Lucy is a very animated, emotionful child. And so she loved being outside. She loved engaging with other kids. And she really, really shut down because she was just in constant itching and pain. So September came and her skin shifted and it turned into, that red sleeves. It was just head to toe, red sleeves. And my homeopath kept saying, "Hey, Jen, I think you should look into this thing called red skin syndrome, topical steroid withdrawal." And
I'm sorry.
resist. Did it
We
happen
lost your
again?
audio for a second.
Okay, am I back? What's the last thing you heard?
I'm not sure.
I'll repeat myself. That's fine.
Okay. Your homeopath.
Yes.
That's where we last
Thank you.
heard you. Now we hear you again.
Okay, thank you. My homeopath really encouraged me to look into red skin syndrome and look up topical steroid withdrawal. And she sent me a number of links, including a link to ITSAN's website and information. When I finally sat down and read through it, I was like, I was shocked. And it was, I could check every single box. What is happening? Am I back?
You're back.
I'm so
I'm
sorry, you
not quite
guys.
sure. No, it's okay. Sorry. Let's pause for 1 second.
Sure.
So, any attendees, if you could type in the chat, are you hearing her audio go in and out, or is it just me? I'm looking in the webinar chat for your answers, and then we'll resume. see. They said she's fine for me. It may just be me. So you just keep going because you do come back.
Okay.
Okay.
Please stop me
And,
if I need to like refresh or something.
okay. And apparently the chat is disabled. But in the Q&A, they're telling me they can hear you fine. So I think it may be on my end. So go on. You said you were dumbfounded, gobsmacked.
Absolutely.
Go on.
All of the above. There was a lot
Okay.
of expletives, to be perfectly honest, when I finally read through the thing and recognized what was going on. My husband and I were like, okay, well, we're in this now. We're not turning around. And that's when I started doing this, all of this research. Now, Lucy completely decompensated. That the child that I knew at 3.5, by the time she turned 4 that November, it was not the same child. She had started her first year of preschool, and she was she was in so much physical pain and distress, and had no language to express this. I mean, I cannot imagine being 3.5 and like feeling the level of pain. I mean, adults express how distressing this is, and they have language to say, this is what I'm feeling. And my 3.5-year-old, we didn't sleep. I mean, she was screaming, she was thrashing her body. It was horrific, absolutely horrific. And there were nights I remember looking at my husband and saying, like, I don't know how much longer I can do this. I don't know. I'm going to give up. Like, slather her in steroids, just give up. And in those moments, my husband was like, no. He had the wherewithal, thank God, because I was so desperate watching my child suffer. It was brutal. I started noticing symptoms in myself because I'm a mental health professional and because I have my own mental health history. My anxiety like increased, my motivation for anything in life plummeted. Anytime Lucy would start crying, I could feel myself, like my chest would start to ache and my whole body would just get like it was on fire itself, but like emotionally, because here we go again. Like, here's another round of this crazy itch that I'm powerless to do anything about. We had terrible interactions with Western medical providers that were equally traumatizing. It wasn't until January of this year that we found an acupuncturist. So we found a local acupuncturist that does laser acupuncture, which I didn't know was a thing, but it is. And I wrote her an email, told her our story. She got us in 2 days. Lucy walked through the door. She knew exactly what Lucy was going through. It was incredible. I could have cried walking out of that office, because it was like, really, I mean, my homeopath was great, but to have someone that I didn't know, right, who had never met me before, had never met Lucy before, look me in the eyes and say, I know exactly what this is. I've seen this and I know exactly what to do, was like, maybe I can breathe again. Like, maybe. And this whole time I'm following like the ITSAN, I'm on the ITSAN like group and the caregivers group, and I'm seeing like, as wonderful as it was to have the solidarity, it was also really overwhelming to watch how bad it could get, right? And to see people posting pictures, is I want to be supportive, and also I don't know if I can watch this, because if my daughter gets like I didn't know what I was going to do. Really didn't. And I feel like a pretty like capable, educated person, and it left me feeling powerless. Lucy had her first acupuncture treatment, and 2 days later she started playing again. She hadn't been playing with toys. She'd been laying on the couch. It was enough for her to just go to preschool. That was all she could manage. And then after her like 3rd or 4th acupuncture treatment, she started singing and dancing again, which is like one of her favorite things to do. She loves to perform. And I was like, I could finally see the potential light at the end of the tunnel. I was hoping it would be like a 3-month acupuncture intensive. It's not. This stuff runs too deep. This is going to take a long time. I fully believe that her homeopathic and naturopathic treatment is helping her body to move through it potentially quicker than she would have, because I see a lot of people saying 3 years, 4 years, 5 years. We're in year 1 and we've made a lot of progress. I wholly think acupuncture was the final like key for, at least for Lucy, to help this, to help her body kind of move through this. We're not out of the woods. The summer was very difficult with the heat. She had a big setback. We still work with a dermatologist at Boston Children's. She's kind, but she doesn't believe me. So that's really more to say I'm working with a dermatologist so that I don't have other questions asked of me from other entities. So that is probably going to scale back from that a little bit. She had a big infection on her skin over the summer that really affected her, but she is she's doing a lot better. And this whole time I'm also a trauma therapist, right? So I'm living this and I'm feeling it and I'm going like, what am I going to do with this? This is never anywhere that I expected to be. So that's my Lucy story.
Well, thank you for sharing that. I know that like a lot of us can relate, whether they went through it themselves or they're caring for someone else. I just like nodding in solidarity the whole time. I just remember this happened with my son when he was 4, and this was 10 years ago. He's 14 now, and he's healed and fine, thank goodness. He does have, I would say, sensitive skin, but it is nothing like before. And at the moment, I'm knocking on wood, he's 100% clear everywhere. He's not having any sensitive spots. But just when you were kind of telling your story, you're reminding me of when I would just hear his door open, and that was it. And yeah. I'm like, what fresh hell will we find now? Yeah. And it's really hard. And I never wanted him to feel like he was alone. Mm-hmm. And so as many times as he got up, then I'm up and just kind of like searching. And I think like one of the things that was hardest for me early on, so my background is I'm a registered nurse in pediatrics, and just having people not believe me was really hard. And even though I'm one of you, I have a medical background, and so maybe you could kind of speak to that, like how you deal with that burden of just not being believed, when I think especially compounded, it's like a betrayal trauma, because they gave this to you, you trusted them, you trusted the drug, and it doesn't work, and now they're blaming you. So it's like a betrayal upon gaslighting, all the things. So let you kind of comment on that for us, because you're a professional.
I am still, I will start by saying, like, I'm very much still in my processing of my experience with providers. And so in many ways it is raw and fresh for me, and maybe in 6 months or a year I'll have something different to say than I'm saying today. That being said, I think what makes TSW so traumatic is that it actually has a dual kind of trauma. There's the medical trauma, right, of experiencing this overwhelming, debilitating condition, and then there's the relational trauma, which is this person that potentially for years, right, I've gone back and forth with and interacted with and shared my pain or my struggles or my story. And this can be related to like our medical providers, our family, our friends, right? They are all of a sudden gaslighting us, turning it around and going like, well, and this is very severe. This is really bad. To me, I still get shocked. And when a provider turns to me and says, this is a serious condition. And I'm like, no shit. That's why I'm sitting in your office. Right. But they're seeing it through this like eczema lens. They are, they have like the blinders on, and TSW is outside. So what I have to tell myself is with Western medical providers is that I cannot expect them to see what they cannot see. I cannot. They are not trained to see this. There's no medical or financial motivation to see this, right? They are not going to. I cannot expect them to. What I need from them is not validation, at least from my medical providers. If I can go in with a different expectation, that doesn't mean I'm not hurt. I'm still hurt every time I walk out the door. Sometimes it takes me 3 to 4 hours afterwards, and I'll turn around and be like, they did not just say to me, because in the moment I'm just trying to get through the appointment, right? But what it is, I think, is what I'm calling relational trauma, or what is relational trauma. This person that you had trusted with a lot, your life, has turned around and told you that you're the problem, right? You're the one that missed you. Oh, you must have misused this. You're the one, right? And there's no responsibility that this other person has taken. And it's horrifying. It makes you doubt yourself all the time. It makes you think you're the crazy person. I mean, that is the key of gaslighting, right? Making you think that you are responsible, that you made this happen, and that the reality that you're living is made up. You made that up. That's not your reality.
Well, and I just wanted to add too, like, this is bringing so many memories, but look at him. Do you see how bad this is? And I'm thinking that's why we're here. Yes, I do. Yes, I see. And even some of the things that we were doing, my son was 4 and he was into touching everything. And so I had him basically mummy wrapped everywhere we went. Sometimes it was actual wraps, and sometimes it was like compression wear garments. I had gloves on him. I'd put ballet tights under his jeans just so that just to keep his skin in, because he was flaking everywhere also. And really to keep the world out, because I wanted to control infection because he touched everything. And I just had some doctors like, what's up with the wrap wear, and what's up with this, and kind of judging that it looked dirty. And I'm like, I bleach his stuff daily. This is a little 4-year-old. This is what would be on his hands and skin if it wasn't on the gloves. So it was very like, any measure I'm taking was questioned, every single thing. And they thought I didn't know how serious it was, and kept on trying to get me to see how, and I'm like, yeah, I know. And that happened from this drug, and it was just too much to wrap their head around. For me, I think it helped to see multiple specialists, because different specialties could see steroid damage. And like, for instance, the endocrinologist could see that he stopped growing. And so their advice is, you shouldn't be using all these steroids if you have a growth delay. He also developed a heart problem. He had like a thickened heart wall.
Oh, wow.
And the cardiologist said, and I was so scared that the heart problem came from stopping steroids abruptly. And I asked her that specifically, and she said, no, this comes from overuse of steroids, and the only cure is to stop steroids. I'm like, so relieved. So even just kind of having those pieces gave me a leg to stand on to go into other specialists, because like you're saying, especially with kids, you're really creating like a paper trail showing that you're getting them care, because it's really dicey.
Yes.
But I really liked your advice of just kind of like managing expectations up front. Like, what are you expecting to get out of this appointment? Because I think, when you're expecting that they're actually going to understand, validate, help you out, believe you, it is soul crushing to have those expectations dashed, and not just not meet the expectations. Opposite, complete opposite. And so anyway, I really appreciate that advice. It's great advice. So go on.
Yeah. So, I mean, I think your question was speak to like the betrayal, like of the relationships. I feel very, I guess, lucky in a way that my family was, they were right next to me in this. You know, my parents were like, wow, we've never heard of this. We'll read about it. Right. My own therapist was like, I've never heard of this. I'll read about it. Like they were open to learning now. And part of that is, I think, just by the nature of my work, and the fact that I work in trauma therapy, the people that I naturally kind of have around me are people that are open to like understanding and learning new things. But not everybody gets that. Um, so that if I hadn't had like my husband's support, I'm pretty sure I would have caved like at some point if I had him. I've seen people post on the support groups that their partner, right, or their friends or their parents or whatever are saying like, stop doing, you're doing this to yourself, like get back on the steroids, this is horrible. And thankfully I personally didn't have that. I still think that fits in the realm of relational trauma, right? So someone who has in the past supported you is now pulling the rug out from underneath of you, and it can make you feel like you're anchorless, right? You're floating in the ocean, you don't know where you are anymore. So I hope that answers that.
Yes, that's really good. And I think and feel free to move through your prepared topics as you want. But where I kind of wanted to move to, maybe out of order, is advice I give people now that I'm 10 years out from this is to expect that this will be a traumatizing experience, and I would say to get therapy right off the bat for yourself, or if your child is going through this. There were things that I saw from my son much later. I thought he was too young. Sometimes it seemed like he didn't even remember it because he was so little, but then behaviors, different things would come out later. So just kind of expect. And for me, a lot of my issues came after he was well, because there was room for me, I guess, because during it was all crisis management. And afterwards, I just felt like fell apart. Decision fatigue is real. Like I was making so many life and death I felt decisions for him that just like I can't make anymore. So, and I remember when I finally went to therapy and they were talking about PTSD, and I was like, no, it's not that bad, whatever. And my therapist was saying, you were fearing for his life. You were fearing for his safety. Every time you took him to a doctor, you're fearing what might happen there. Are they going to, even try to take your child, say you're not doing a good job? I mean, there's a lot. And so it was kind of like the hypervigilance. Like I said, every time I heard the door open, it was kind of like all of that was back. And so anyhow, if I could speak, I'm not coming from your background, but if you could kind of like comment on what that trauma is like and what to do. I also, sorry, there's questions in the chat.
Okay.
And I'll tell you this to put a pin in it, but they are asking, what are some tips for social anxiety while dealing with TSW? My wife is nervous to be in public due to her physical experience, and how can I better support her as a caregiver? So.
Bring me back to that. Okay. Let me speak to the trauma part, and then and then bring me back
to the question. Okay.
Yes. So you're right on, Kathy, in the sense that I would recommend to anyone who has access to therapy to go right away, to get on a wait list. I mean, here in Massachusetts, it's very difficult to find a therapist. There's a lot of need and not enough of us to go around. And training a therapist takes a long time. So there's no one like busting into the field right now. And post-COVID, it's just, we've all had many traumas, also related to TSW. So I would do that as quickly as possible, and preference to anyone who has a trauma lens or has trauma experience. What I have found is that most people's definition of trauma is something violent, right? Or something physically that you can like see happening, right? I mean, we just had 9/11 pass, and like everyone can say like that was traumatizing. Even watching it, right, was traumatizing because it was so visual. Or when there's a violent episode of some sort, whether physically or sexually, everyone can go like, yeah, that's traumatizing. Clinically, trauma has two kind of components. And the first is that something in your livelihood is threatened. Okay, so your physical being is threatened, right? Your life is threatened. Your emotional self is threatened, right? Think about like verbal or physical or emotional abuse. You are threatened sexually, you are threatened financially, you are threatened medically. Your body is under stress. So when there is a threat that is enough to make you unable to be your typical self, that's like number one. Now, if you think about that, like that could really be anything, right? And then the second component is that to meet this threat, you don't have enough internal resources to manage it, right? You cannot match the need of your own accord. So when those two things happen, some aspect of you is threatened and you don't have the resources you need internally, whether that's emotional, whether that's financial, whether that's medical, whatever. When those two things combine, that is a traumatic event, right? All of you listening are going like, oh my God, TSW is a traumatic event, right? Like it fits right in those categories. Not all of us who experience a traumatic event will develop like clinical PTSD, but I do think that it's worth understanding that even traumatic responses can exist on a spectrum. And just because maybe you don't have clinical PTSD does not mean that the symptoms you're experiencing aren't valid or aren't real, right? So when you're feeling that, hypervigilance is a huge traumatic stress symptom. When you're feeling that on edge, you're sensing that in your body. Traumatic stress affects your mood, affects your anxiety levels, affects your central nervous system. Like it's the whole thing. And our bodies and our minds and our emotions are deeply connected. These things are not separate, right? So what's happening to the body is happening in the mind, and what's happening in the mind is happening in the body. These things are across the board. Experiencing a trauma changes how we relate to ourselves. It changes how we relate to other people, and it changes how we relate to the world, right? I don't look at providers the same way anymore. When I'm telling Lucy's story, there's a warning in the back of my head. When my husband and I are talking about posting things on social media, how much do we post? Who's going to report me? Is somebody going to report me? Is somebody going to judge me? These are not questions that I ever asked myself a year and change ago. Now I will, and I always will, because of this thing that happened. And that's what trauma does. So I think it's really important to recognize that trauma is absolutely the appropriate clinical language to describe what TSW is when we talk about mental health. Do we have questions about that or thoughts?
I'm just like, amen. The part I kind of wanted you to explain a little more is where you were talking about how you view things differently. It changes how you view. I mean, you listed like the world and you listed a few things like that. If you could maybe expand on that a little bit, because
Sure.
like, yeah, it changes who you are, and it may change who you are for a long old time. And just to kind of put my little personal experience, I felt like definitely changed who I was big time. And I think in my marriage, I think both of us had this feeling of, and someday we'll go back to normal, and someday this all goes
Yeah.
away and it's how it was. And it's like, no, that's not a
Yeah.
thing. There's a new normal, and I kind of feel like it does forever change you.
Mhm.
And as long as you can both kind of acknowledge and roll with that, you're
Mhm.
okay. But some people can't, because like, this is not what I signed up for. This is not the person I married. Just all relationships kind of shift and change. I feel like also just for me, realizing who showed up for me and who didn't. That's
Oof.
another real eye opener and big shift in changing kind of who you are. So
Yeah.
maybe if you could kind of speak to those things a little bit more.
Yeah. Yeah. When there's something that is so threatening to us, right? That we are about to experience either the loss of our actual life, right? And there's sometimes when TSW feels like I might die. This could be death. Um the and I want to say, like, is compounded by this relational trauma that we talked about, like with our loved ones and with medical providers. There's a schema change, and schema is kind of like a word to describe how we map the world in our own brains. Each of us have our own kind of like mental schema of our values and our morals, and there's a lot of things that can be included under that, and all of that is created through our lived experience, right? So some of that is kind of taught to us by our family or as we grow up, and then as an adult we decide, like, am I going to keep these beliefs? Well, as a teenager, really, that's when it really starts. Am I going to keep these things? Is this who I am? What am I like? We're developing this sense of identity, and so we create these mental schemas of the world, and those all start relationally, right? So how we relate to our parents, how we relate to our friends, what our experience as a child was. This is why that trope of like you lay on the couch and talk about your childhood in therapy comes from, because like that is kind of true, because that's how we made the image of our world, is through those experiences and through those relationships. Well, the image of our world continues to change as we become adults when we have different and new relationships. So you can think like, when I was a kid, I thought everyone's parents was like my parents, right? Until I started hanging out at other people's houses. And I'm like, ooh, your mom lets you watch PG-13 movies, right? Like, ooh, your dad, whatever it is, that makes them different. And you start to realize, like, oh, there's different ways of parenting. Oh, I don't know if I like the way my parents parent. I don't know if there's different ways that moms relate to their children. Right. And so you start exploring like all these different types of relationships. When you're an adult, you've kind of set how that is in your world, right? These people can be trusted, these people can't. This is how I relate to men, this is how I relate to women, this is how right? The list goes on and on and on. You come into any traumatic experience and all of your relationships are affected. So all of the things that you thought you knew about the world aren't true anymore. All the things that you thought you knew about those other people in your world, in your schema, in those relationships and those attachments might not be true anymore. You have to make a whole new schema for where there's meaning, where there's trust, who can be trusted, who can't be trusted. It's like, and this is true for any trauma, it's like literally pulling all the roads out of your brain, all the little maps that you've made to your connections to people and places and things and understanding, wiping it clean and telling you have to figure it out all over again. Does that make sense? Okay.
Yeah, and that's what it feels like, because
Mm-hmm.
just how the world works. You
Yeah.
think, I've discovered how the world works, and
Mm-hmm.
you can always trust your doctor, and you can always trust what they prescribe. And for me especially, being in the medical community, I was
Yeah.
not looking for this, and that was another thing that kind of bothered me, is that I was treated like I was somehow anti-Western medicine, or you know, I No, I'm very pro and I'm shocked at this. And I just felt like I would be treated more like a colleague,
Hmm.
like we're figuring this out together. Like this is what we're observing. What
Hmm.
could the answers be? But it was a
Hmm.
kind of immediate, I've shared this before, but it was very I not over it. But one of the things the doctor wrote in their notes was um, that my son's condition was so severe due to mom's mismanagement of his condition. And I'm like, okay, so 3 years on topical steroids, he was horrendous. I mean, all of his health was down the tubes, basically. In 18 months off steroids, he's a healthy kid. Like, which
Hmm.
one looks mismanaged to you? And so I think for me, a lot of my involvement with ITSAN really is kind of to like right this injustice because
Yeah.
and find like good scholarly information because I don't
Yeah.
want people put in this position where they're treated like they're mismanaging something rather than we are all observing this together. What could it be? And could it possibly be that the medication is causing a problem? Because other medications cause problems, and that seems to be accepted. There's a real gap here that we're trying to connect all the time, patient and caregiver, and just the understanding. Um, it is not steroid phobia. It is something actually happening. We're not afraid something might happen. We're seeing something really happen, really did. And so, anyway, that's kind of where we try to connect the dots. But yeah, I think that's a really helpful way of thinking about it is that you have these like roads and pathways and this is how you understand. And when you go through something traumatic, it's just like we have all new roads, we have all new paths and paths unknown and
Yes.
still lost,
Yes.
So
Yes.
that's a really good way to describe it.
Yes.
Um,
I want to be
sorry,
able
if
to. Oh, sorry. Go ahead.
I was going to go back to the question, but if you want to
Yes.
add before we do, feel
Yes.
free.
I was going back there too. So this is, I'm actually going to give a two-part answer to this because I think um, what we're seeking is like intervention, like social anxiety intervention in the moment. And what I'm actually going to recommend is both intervention and prevention, right? So there's things that actually we can focus on before we get to the social dynamics, and the intent is that the social anxiety would naturally be lessened because we've done these other things ahead of time to help that person manage in that moment. And then there's the stuff that we can also do in the moment, right? And so I I said to you guys already that the body and the mind are deeply connected. You cannot only focus on one. What happens to the body happens in the mind and vice versa. So whenever this is across the board for trauma or severe anxiety or even severe depression too, I actually say, let's focus on the basics. We need to focus on getting your body into a safe space because if your body doesn't feel safe to inhabit, it doesn't matter where you're going socially. You're not going to feel safe and your anxiety is going to be present, right? So there's three things that I focus on. The first actually is sleep, which is like impossible. It sounds so basic, right? Which is impossible in TSW. There's two things that happen in sleep that are critical to the brain and the nervous system. So our body like manages its cortisol when we sleep, so that if we don't sleep, we're building on the cortisol that we created the day before, right? And cortisol is the stress hormone. We've probably all heard a lot about it. The lack of sleep raises our cortisol because our body isn't able to deal with it the way that it typically does. Our bodies also, we're constantly regenerating cells. We're constantly regenerating like nerve cells and neurons and everything. And there's a part of that, our neurons, nerve cells called a myelin sheath. And I'm not an expert completely in this. So Google this. But the myelin sheath is something that protects our nerves and helps us to duplicate our neurons in an effective way. And the myelin sheath is regenerated in sleep. So if we do not sleep, not only are our bodies building on the cortisol that they had the day before, they're also not able to regenerate their actual cells, right? Sleep is one of the single most critical things that I like talk to clients about all the time. And I can only hyperemphasize this so much. Whatever helps you sleep, you do it. You do it. And there's lots of things out there designed for sleep. And I can't make a general recommendation. Different people use different things, but whatever makes you get sleep, you focus on that because you're restoring your nervous system. And your nervous system is deeply related to your anxiety. That's number one. And then number two is actually your food, right? So our food powers our brain, which powers our body's ability to regenerate and sleep and all of those things. So there's a lot of information out there about like superfoods or different foods that help cleanse the body, different types of proteins that could be more or less beneficial. You know, do your research, get your food, get your nutrition, because without it, you're also not going to be able to sleep. These things are like deeply connected. Does that make sense? You're the only one I can see nodding their head, Kathy. So I'm just going to go with your head nods. Okay. All right. And then the third thing I would say is if you're a working adult, like if you're an adult who's experiencing this, if there is any way to get disability, get it. You don't need to be worrying about anything else but this one thing. Like this one thing. If you can't get disability for a physical condition, get disability for mental health. That is possible. I've written many disability requests, taken it myself to get the time that I need to be able to focus on sleeping and eating, because TSW is so debilitating. Like there's no way. There's just no way. I fully realize that that's not possible for some people or financially, but I think that we will heal faster if we are able to take a lot of things off the table, right? Including and especially work. So focusing on those things can help build the prevention for that social anxiety that is naturally going to be there. Do you have any thoughts about that, Kathy?
No, I just nodding in solidarity. I think
Oh, okay.
it's a good point. Like, if there's any way, I never thought about disability for mental health. That's such a good point, because it is really difficult to get it for TSW in particular. Some people are able to, but it's a difficult thing. But for mental health, which is 100% an issue during TSW, that's a really good point, a good tip. And I think this is also the time to call in any favors. If there's any way you can, if you have family who can support you, or even move in with someone or something like that. There's different routes, but I agree with like just focusing on this one thing if possible, because it's a lot and your body's doing all of this work of healing, inside out, mentally, your nerves, it's all of it. So I think, yeah, that's really good advice. And then you had tips for in the moment. So this was kind of like preventing leading up to it, and then you're in the moment.
Yes.
And what do we do if we're feeling anxious?
So I think there are multiple routes you can go. I think the best thing for social anxiety is to have a supportive person with you, right? Someone who can help you refocus. Hey, look at me, don't look at them, right? Like it's just us here. Like, let's do this. I also think there are some, and you can YouTube or Google this, there are some body-based interventions that can really help your heart rate go down, help your breathing. A lot of times when we're anxious, we're holding our breath, or we're taking shallow breaths. And what that does is that perpetuates the anxious cycle, because we hold our breath and then our heart beats faster because we're not breathing. And then we hold our breath because, oh my God, my heart's beating faster. And then it becomes this cycle. So if you go onto YouTube, there are tons of therapists who have I think what I would search is like grounding techniques for anxiety, or body-based interventions for anxiety or panic attack support. And there's a whole list of things that are things that you do in your own body that have nothing to do with like anybody else around you, right? To help you manage those things. Grounding techniques work best when you practice them when you're not anxious, so that when you're anxious, you can still remember them. Because when we're anxious, all the other thoughts, but the anxious ones like leave our brain, right? And we can't access that part of us. So go on YouTube, search grounding techniques for anxiety, practice them in the safety of your home. And then when you are going out into the community, use the ones that you connected to in the community. And then I would actually also say, be proud of who you are. Wear your bandages with pride. Do not walk through the door with your head down. You have nothing to be ashamed of. And if you walk through the door with everything that you can muster that says like, this is who I am and you're going to accept me, there's a lot of people who are going to do nothing but that. Do nothing but that. And the best way to help yourself do that is to get in therapy, because that person is going to hype you up and speak into you in a way that can help you walk through the door with your head held high.
That's really great advice. Both of those things. I remember, so my son was kind of out of harm's way with TSW. But I think around the time he was 6 years old, TSW was mainly the whole time he was 4. It was like right before he turned 4, and then he was good kind of a couple months after he turned 5. So this is when he was 6. He had to have his tonsils out. I have a home phone. We're in the 1900s still, and we don't answer it, so ignore with me. Okay. So he had to have tonsils out, and so I remember telling my therapist, like, anything happening to that child is so triggering to me. I feel like I'm going to freak out, like just in the waiting room. And so she told me exactly that advice of grounding techniques, mindfulness. She said there's like 5-minute videos. I was supposed to do one every day, every single day. And then during the surgery, the kind of like the grounding techniques that she taught me was just basically all you're thinking about is what's happening like right now. Like my feet are on the ground. Do I feel carpet? Do I feel concrete? Do I, and all of your senses. It smells like this outside. I hear birds. So what you hear, taste, feel, see, there's air in my lungs. You're just telling yourself in this moment, I'm okay. Like it feels like a gorilla is chasing me. But she said those feelings are very real, but they're not true. So it is a real feeling. That's not what's really happening. With grounding, you're kind of centering yourself in what's actually happening. And so it really did help. And honestly, I think even just having that skill in my back pocket made it so it never really got that bad. I was more afraid of having the panic attack than actually having the panic attack. I also want to say, to your second point, like, if somebody had a disease that everybody agreed was a disease, they wouldn't come into a social situation being like, oh, I can't, everybody knows what cancer is or what, I don't know. But I think that we kind of have some trepidation because of all the judgment around it, because people don't believe us. But this is a real thing. And you, like what you said, you have nothing to be ashamed of. You have nothing to hide. You go into it like that. You talk about it like it's every bit as real. And you can, annoying sometimes, but educate people. And because they don't know. I mean, I had friends saying, well, what does the doctor say? Like, well, the doctor says to use more steroids, but I know that, in my soul, especially 10 years ago, it was a little different landscape. I feel like doctors are some are getting on board. We've had some people in the groups who were diagnosed on purpose by their doctor without them ever bringing it up, which is a crazy step ahead. Usually it was almost always the patient bringing it to the doctor's attention with research in hand. So we're kind of crossing into a better place. But yeah, I think just kind of giving yourself that validation that like this is a real thing. I didn't do anything wrong. And if somebody has a problem with it, it is their problem. It is not your problem. So anyway, all great advice. So we're coming up on time. Was there anything that that you wanted to cover before we wrap up? And if anyone has any last minute questions, feel free to type it in the chat.
Nothing that I could finish in 3 minutes.
Okay. All right. So this is a lot of really great information with good takeaways. We did record this. So if anybody wants to watch it later, or if you found something helpful, you can refer a friend to this resource. I'm looking in the chat and I'm not seeing anything else. We have 2 minutes. We have a couple minutes. I'll read your question.
Yeah, get your question in, guys.
Yeah. But if not, I'm gonna call it. And thank you so much for your time and for your advice. And I think even just it's so good to people validate your experience at all, and that like this is real, and you're also not alone. So thank you so much for doing that for us.
Hold on, Kathy. I see one more question.
Okay, we're here for it.
It says, what techniques can we use to support our children battling depression from this journey? My daughter's been in therapy for years, but I think she's becoming older and stuck in her decision not to practice these grounding techniques. Oof. I don't know how old your daughter is. The short answer to this is that 18 plus, they get to make their own decisions, whether they're good or whether they're bad. Oh, she's 8. She doesn't get to make her own decisions. You are the parent. This is hard, okay, and probably deserves longer than the 1 minute that I'm going to give it. I believe in choice for my daughter, and there are many times when I will present her with choice, because I know a lot of times children feel powerless, and when they feel like they have a choice, they are happier, right? They are more willing to engage in things. They're able to learn. They're able to move on. There are a few things as a parent that I have decided are not a choice. This is what you're going to do because I am your mom, and I'm a licensed therapist, and I know what is good for you. And any parent out there who has a child, also, I'm sure you have lines, right, or boundaries that you don't want to cross, things that are like, this is what our family does, this is what's important to us. And so my encouragement for you would be to decide what those are based on your specific situation, right? What are the battles that you really need to fight that you know are not only important for her present, but her future? And then what are the things that you can let go? And if you need more help, go to a therapist.
Yeah, I think that's really good idea. It's kind of like pick your battles. And I think my son was so young. Some of the grounding things and stuff like that, I would say, like you do it together. It's like the whole family's doing it. You know, it's not like, well, you're the problem child and this is what you do. You know, it's kind of like it's good for everybody to have these skills. And I think it's something that you could all do together. For what it's worth.
So I had a battle with my 4-year-old today over whether we were going to use ice for her itchy feet. And it was a battle, but it was one that I was willing to fight because I was like, you are escalating yourself to a point that you're going to have a breakdown. You need ice on your body. You need to calm down. Mm-hmm. And so I forced it. And then 3 minutes later, she went, oh, mommy, my feet feel better.
Imagine.
Deep breaths.
Deep breaths.
But if she wants to like write on herself in marker, I don't care. That's not my battle. Right? Like, you gotta pick.
Yep. Okay. Well, thank you so much for your insights and your advice. And I know that I learned a lot, and I've been in this for a long time, and I learned something today. So I know everybody else did, and it's really helpful. So thank you so much, Jen, for your time.
Great.
And everyone, feel free. We're going to post this on our YouTube channel soon and on our website. And in the when we post it on YouTube, you can make comments and ask questions, and maybe we'll look in there and be able to answer some stuff still. So anyway, thank you so much, and have a great evening.